welcome back to another episode of the Nursing Now podcast. I am here with my dear friend Manny Ortega, and he was a pharmaceutical representative, and he's going to share what that was like. So, Manny, thank you so much for joining us from Spain.
Yeah, absolutely. Thanks for having me. I always enjoy talking about this stuff, and I know my journey's been a little bit crazier than maybe some other folks, but I think there's a lot of opportunities. So, yeah, I can just start at the beginning if that's cool. So again, thanks for having me. I've been a nurse for 15 years. I was doing the math. I was like, oh my gosh. I started in North Carolina, and I started working on what's called a task division, trauma and surgical services. And I did that for, I think, all of 3 years. And I did a bunch of different things, floated all around the hospital and absolutely loved it. I mean, trauma was really like a huge love of mine, and working with bariatric patients and all of those things. And then, yeah, so then I ended up like jumping into a sales role from there. And I think that that's kind of like where the business side of things kind of like lit up that side of my brain.
So, and correct me if I'm wrong, did you transition to an oncology role? And then was your sales rep job in oncology? So do you think that having that bedside experience helped with that?
Totally, yeah. So I actually got hired for an oncology floor, one south at it was Vidant Medical Center back in the day. It's Pitt County now, ECU Health in North Carolina. Awesome hospital. Huge shout out to them because they really made me into the nurse that I am today. Lots of opportunity there. And so one thing that I've made a bunch of notes here, and I know this is a podcast for everybody. And so I'll just give some old guy advice right from the get-go. I mean, truly having like a common denominator right off the bat. Mine's always been oncology. And from there, like I said, I've had different types of offshoots, but really just trying to be like focused on one thing, be it cardiovascular, neurosciences, neurosurgery, whatever it is, traumatic brain injury, whatever your passion is. Always try to keep that in mind if you're ever thinking about transitioning maybe into a business role or something that might be a little bit more non-traditional. So I worked as an oncology nurse, and then I did a little bit of home infusion. And so I worked for a company that was called Advanced Home Care for I think another 3 years, and that seems to be my number. I think I'm looking at it. And and so I did that. I was, I met a guy through just networking at the hospital as much as you can. I used to see a rep come through. I'm like, you're a nurse? I'm like, what do you do here? Right? Because that's like a very common question that I ask people. And, he came in, Eric, and he's like, well, I'm going to be leaving this role. He's like, I come in and I educate patients. And so what we would do is send them home they'd go home with PICC lines, usually like a double lumen PICC line. And I would teach them how to use the PICC line and how to troubleshoot it. And I was a liaison with the offsite pharmacy for TPN, for those of you who know, it's all these infusible drugs, even chemotherapies, but mostly antibiotics and, sometimes some analgesics as well. Anyway, so there's this whole cascade of different types of accounts that we would have it was a trauma one center, and it was like a 1,000-bed hospital. So that was my territory. And so that was my first foray into sales. And thankfully I did well. And it was one of these things where I was like, this is really cool. I mean, I get to talk all day, right? And then just like educate patients. I was like, this is perfect for somebody like me. So I left that job. We ended up coming back up north. We had landed in a town called Cornish, and we knew that we were going to be in southern Maine, and my mom lives up there as well. And so there was like this huge family dynamic trying to get back up north. And I ended up working for a boutique hospital just for a short stint. It was like a 6-to-1 ratio. And for me, it really wasn't, I had gone from working in North Carolina with a hugely different demographic. Came back up north, and I was like, it wasn't like totally my vibe. So I ended up like, long story short, working with a surgeon. I have a buddy who's a surgeon that I worked with in North Carolina. We were like, hey, he's in Maine. And so anyway, we invited him over to dinner, ended up getting the job as a surgical oncology nurse navigator for Maine Health, which is the flagship hospital for a large system throughout Maine and in New Hampshire as well. But anyway, so I did that for, again, 3 years, I think. And then, my work mom, Gina Blazek, she'll probably watch this. She was like, Mandy, she's like, you've got to go to some of these rep dinners. She was like, you're like them. I was like, I don't even know what that means, And so I was like, okay. I was like, oh, after lots of like conversation about it, I ended up attending a few of them. And so again, back to the networking piece, like
Yeah.
I quickly realized I was like, okay, so if I can go through, and I worked in immuno-oncology at Bristol Myers, and so awesome franchise, and just they do so much great work for patients. And so yeah, I was like really blessed to get this job. I ended up like meeting some of the reps, and they're like, Manny, this is a great job. There's so much that we could talk about with the pharmaceutical rep role. And again, if anybody ever has questions, they can just like, I guess just contact me as a one-off because it's a lot. It's a lot. And I know
Yeah.
one of the questions that you had was regarding, what it looks like to be a pharmaceutical rep.
Yeah.
So started off working in psychiatry at Boston Medical Center, which
Yeah,
I
I
mean, they've
saw
all
that.
changed names. Yeah. But
Yeah.
so yeah, no. So I think working as a pharmaceutical rep, it's just like there's just so much education, and it's like it's you asked what it looks like. So as a
Yeah.
nurse, you're standing for like 13 hours, right? The
Hmm.
brochure tells you 12 hours. The reality is like you're actually like you don't get lunch, right?
Yeah. Yeah.
And your handoff never takes 5 minutes when you're coming off of a shift. So the reality is like as a pharma rep, like really you're out there and you're hitting your accounts and you have a designated territory and I can't tell you exactly what mine was, but suffice to
Hmm.
say that it was pretty large.
Yeah.
And it was great because I was able to get out there and talk to nurses and just like all types of different physicians and all the stakeholders that work with the patient.
So
And
cool.
yeah, no, it was awesome. And for me, it was like a great segue into the business world because I understand the multidisciplinary team. So
Yeah.
if I had to say like nurses, like never doubt the fact that like the knowledge that you have about the patient journey, one of the things that I wrote down is like,
Hmm.
why would someone like me be, sought out? The reality is having that knowledge of the patient journey, understanding what they go through. I mean, truly,
Hmm.
like those are things that are really like large companies want to know about that stuff. And I mean, I
Yeah.
think you could be a consultant. You could be, I know pharmaceutical companies have more than just being a pharma rep, and it's not just being a
Oh,
pharma rep. Yes. You could be a clinical nurse specialist. You could be a clinical nurse consultant. I have my master's in leadership. So, I mean, that's something that if I wanted to be a medical science liaison, I know that at some point that's something that I considered. Um,
wow.
all of these like jobs are amazing. And, you think, these are companies that I'd say, all of your top 5, top 10, all of them are global companies, right? Like there's
Mm.
like none of them are just like in New Jersey or just in New
Yeah.
York City, right? So
Hmm.
I think when you think about for young people who are looking for portability, who are looking for that upward trajectory or, like the what should I be doing in 3 to 5 years? This is like 100% couple things. That common denominator with like trying to keep it oncology, cardiovascular, like I said at the beginning. Also networking and just making sure that you're setting yourself up for those conversations along the way because you don't want to start preparing when you're ready or, like you said, when you're burned out, right?
Hmm.
So
No, that's beautifully said. I also had no idea how many roles there were for nurses, like that you just said. I pretty much only thought that there was pharmaceutical representatives. So thank you for really highlighting the diversity that nurses had right there. That was great to hear. Thank you.
of course, yeah, and it doesn't stop there. I mean, one time, they had this meet and greet, and they, at my company at Bristol Myers, and they were like, come meet these people, blah blah blah, medical affairs or whatever. And I was like, medical affairs. I was like, that sounds important. I'll sign up, right? Because I'm always down to meet new people, and so I
Yeah.
signed up or whatever. And I showed up, and guess who was in the room was a bunch of nurses, and I was like, oh my gosh, you guys! I was like, and they were like, come work for our team, and I was like, well, like, so so I think the other thing that I would say too, it doesn't matter if you're like not there yet, right? Say you're like, oh, like, somebody like I've always been like a planner, like, oh, I've been here in this role for a year, but I've always been planning ahead. I
Thanks.
think the thing is raising your hand. I've always been part of like 5 committees, right? It's probably part of my like ADD, but um, you can raise your hand. And I think that like, the reality is I lucked out meeting that rep when I was working, on the bariatric floor, but the reality is, if you're raising your hand, how else are you going to get in front of the hospital executives? How else are you going to start building a resume that's going to help propel you forward when you're like, hey, I have business ideas. Hey, I've looked at, a P&L sheet I don't even know, like I've looked at a business plan. There's a million things that as nurses, I think that we should, and I won't get on a soapbox here, but I think that there's a lot that we need to like really work to expose ourselves to as
Mhm.
nurses. And you do that through committee work in a hospital. So I'll leave
Mm.
it there if you have any questions. But I think that if you're just coming in, you're clocking in, for me, it was 6:38 in the morning and clocking out at 7:08, then I can tell you that you're really missing out even as a floor nurse, because at that point, like you're cutting yourself off at the knees, like truly, because you're not doing the networking internally that,
Mhm.
that you could be doing, because externally is tough when you're working night shift. For instance, I work weekend options. So
Yeah, yeah, there's so much opportunity at a hospital. As an introvert, I've worked so hard on networking and putting myself out there, especially the last like year or so. I've gotten really good at just saying yes to new opportunities. And there's been a lot of growth the last year for me that I didn't really know was there.
yeah.
I don't think I understood the weight of networking, especially as an introvert. I was like, I have a master's degree that will really carry me. And like, it really doesn't. Like, networking is what opens doors and gets your name and your personality. And like, yeah, it just opens doors. It's wild. So, yeah, networking. Manny is actually the king of networking. So,
Yeah. Yeah. People at Bristol are like, how the hell do you know everybody? And I'm like, you just follow up, But I want to
yeah,
say something, and I'm going to double back. So
please.
kudos to you. I could never host a podcast. I can tell you that. Like, it's like I'd be talking the whole time and they'd be like, why'd you even bring me on? But so kudos to you. And it sounds like you're taking the steps to kind of like, break out of that, like, shell that
Yeah.
you feel like you've been in. So I certainly wouldn't underplay that. I think that a lot of nurses could also sign up for like ONS, for instance. I was on the board for Southern Maine ONS. Shout out to them because they also do a lot of great work. And so like there's so much that you can do. Guess what? Your hospital might even pay for ONS. Like I think that, as nurses, like we have so much, we feel like we're just focused on, going in and,
Yeah.
titrating the meds and making sure that we're calling the docs at the right time. It's like that's such a small piece. Every day that you go into that hospital, you're going to be building what you're going to be doing next, regardless. Right.
Mm,
Regardless as to what you're doing. Guess what? If you work in rehab as a nurse, like you could work for a medical device company that works on, prosthetics and stuff like that. So I think that if nurses think creatively about where they want to be, they can start building that early on. And I know I already said that. I'm doubling back on that, but I think it's important to highlight.
no, thank you for that rehab example because I think that a lot of people think mainly oncology and ooh, what's the other big one right now?
Cardiovascular.
Yeah, cardiovascular are like the main two for pharma right now. So yeah, that was nice to see that example really brought home because there's a lot of people that do work in rehab and they might not think that it's the most like lucrative position that they're in right now. So that's interesting to hear.
Yeah, I think a lot of people want to end up in oncology, for instance, or they want to end up in cardiovascular. These are
Yeah.
both like, very, very like large franchises, right, within a company. But totally, just to like double stamp what you said. I mean, truly, like there's no right way, right? Like I think that you think about, for instance, in the corporate environment, most people are going to spend 18 to 24 months in their position before they look to do something else. So that's known. And a good manager, I've had a lot of good managers, working in pharma. Like I've been really blessed because they're like, hey Manny, let's help develop you. And let's make sure that you have a plan. So if you don't have that kind of manager right now,
Mm,
find a mentor, right? Find somebody like who has done, I mean, like somebody like me, like for instance, who's like really done this sort of thing, who said, or like somebody who wants to do podcasts or something, like, call
yeah,
you, right? Like, how
yeah.
did you do it? Where did you start? And I think just making sure that you're being intentional because, you said it earlier, excuse me, you said that like like with a leadership degree, like maybe like these things would just land and like kind of like drive themselves. Nothing drives itself. Like
Yeah,
you have to go out there, you have to build your brand, and there's we could probably do an entire podcast on branding, but
yeah.
it's a big transition coming from the bedside to the business world, for instance.
Mhm.
I mean, it's even difficult going from like oncology to cardiovascular in the hospital. We keep talking about it, but like,
Yeah.
so I think just kind of knowing where you want, making sure that you're putting those pieces together and, being intentional about it for sure.
Um,
No, you're
um,
good.
just just circling back to what a pharmaceutical rep does. So, are you educating the patients? Are you educating physicians and nurses? Yeah. Okay. Okay. That's what I thought. That's what I thought. Okay.
Yes.
Interesting.
So
So,
yeah, so as a pharmaceutical rep, you really come in, you're talking to physicians, you're talking to nurse practitioners, you're talking to sometimes different people on the multidisciplinary team. They could be, for instance, geneticists. It could be somebody who's a tumor registrar, excuse me. I ran tumor board, so find out the nurses who's doing that. So it's like this whole network, and you're always trying to say, all right, how can I get this new education or this new readout to the physicians, because that's really what you're there for, to make sure that they understand what the best options are for those patients.
mm,
And so, yeah, anyway, I'll stop there because it's a big answer, but that pretty much answers it.
no, fascinating, fascinating. It's interesting that you're influencing patient outcomes from a totally different field. So that's pretty cool to hear.
Yeah.
Um, and so you have a huge life transition right now. Right
Yeah.
now you're in Madrid. So how are you doing with that? Let's chat about that for a second.
Yeah, totally. I think, probably important to talk about how it came about.
Yeah.
It's been like over a decade in the making, and I met my wife. Her dad lives in Madrid, on really close to us, and we've been visiting
Oh,
Europe for a long time. And my son took his first steps in Madrid. Like it's so we've got this like super, I don't know, long history of like coming here and excuse me.
mhm. That's awesome. I didn't know that her dad was in Madrid. I knew your mom was in Maine.
That's
So
right.
that's really nice that you spent time close to your mom in Maine and now you're spending time close to her dad in Madrid. That's really nice.
That's right. Yeah, we have family all over, and my mom's not happy about the move.
I bet. Yeah.
But it's tough to get the grandkids over the pond and try to coordinate. I'm like, Mom, it's like 6 hours north or 6 hours east. I'm like, "Wait, but
Yeah.
it's fine. Maine's a huge state. But yeah, no, to answer your question, I guess like succinctly, things are going well. We're in an apartment right near the center, which is nice because we wanted to make sure. And the whole thing with us, and I won't get too far into the philosophy, but it's making sure that our kids understand, they're 13 and 10, making sure that they understand that like you don't just have to like grind your entire life. Like you don't have to just like, grind for the better car, the bigger house, whatever it is. And so what we're doing now is twofold. We're showing them that we're trying to just hopefully, instill that philosophy within them. But second, we're just also setting them up so that they can live anywhere, in the European Union when they get older. And so that was really another big part of it.
Wow. Wow.
Yeah.
But you're there now. And I bet it's much better weather in Maine because I'm in New Hampshire right now and it's pretty dreary right now.
Totally. No, it's and I do. Maine is beautiful, right? Maine like has like
It is.
you get all of the seasons and stuff like that. But it was a little
Yeah.
chilly. I mean, it doesn't get into the 40s here, which like people in Maine are probably laughing at me right now. But
Yeah.
it's daytime highs are still in the high 50s, and like like I said, I'm from California, so like this for me is paradise.
Yes, yes, that's like probably your ideal climate. Yeah.
Totally,
Yeah.
totally, yeah.
It's funny. I was talking to someone today, a little bit earlier, and he was considering moving somewhere from the UK, and he was considering the Northeast. And I was telling him Maine was my favorite Northeast state for sure. Like it has the mountains, it has the ocean.
Yeah,
Portland's super cute. So he wasn't convinced about the snow though, and I was like, yeah, I get it.
yeah. That's like my number one reason that I moved away. Like I'm like having to like shovel or snowblow 3 times within one storm. I was like, I'm all set. But
Yeah.
but on the networking side, and really,
Yeah.
I guess just to bring it back to the business side on Spain. I mean, I took a couple notes on what it's like to network here. I mean, I think one thing is not to take for granted their business rules can be different in different
Mm,
countries and stuff like that. And it's a big chat, I guess, just about how that transition has gone. But it's been really great. I feel like people are super into like meeting up for a coffee or a beer just to kind of chat, get to know each other, and just like we're doing right now, but like in person. And for me, that's like, I love it. I love it. I literally, I took a train 15 stops the other day to have coffee with somebody, or it was a meal, but have a meal with somebody and just learn about like, see if there's synergy and stuff like that. And one thing that I would say for people is like, if you have the opportunity to network and go to like expos, you'll see on LinkedIn. And I recently went to a cyber defense exposition. I was invited by somebody, and I was like, "What is Manny, the nurse who worked in pharma, going to a cyber defense, expo?" Well, guess what? Ends up, I met some people who work for a life sciences company, and they're like, "Yeah, well, part of what we do is we protect companies on the cyber defense side." So they work with different like CRMs to make sure that those companies, even if they're pharma companies, have what they need. So you literally never know what that dotted line is going to look like and when they might be looking for somebody with clinical knowledge. So so again, just like, don't ever say like, I'm not going to a cyber defense expo, like I think take it as a opportunity to meet new people for sure.
Yeah, yeah, I couldn't agree more. I've seen like expos over here too.
Gotta go.
Especially in life sciences too. Um, yeah, I that's on my list to go to. I imagine there'd be a lot of opportunity there.
Well, I was talking to my wife, about these things because, like, I talked to her about everything, but I was like, even if it's the sort of thing where, like, you have to take a day off, like, guess what? It's an expo. Like, most expos are 3 days. You have options, like, or at least a couple days, but, like, you have options to go. And again, your company might pay for it. So, like, I think that, like, try to see what you can get expense, talk to your manager, and just give them a good business rationale for something. I mean, it's like
Yeah,
never a bad thing. And, um, at the end of the day, I think one of the biggest things that I could say for that is make sure that you follow up. I think, I get a lot of people who are like, oh yeah, totally, let's follow up. Like, let's, or like set up some time or whatever, and they never do. I think that in this world where everything moves so fast, I think just being accountable and showing those things early on and really just like, like for instance, if I ended up like blowing off this podcast, you'd be like, well, like I thought that we'd like worked it out and all that stuff. So
uh-huh.
I think just showing accountability, like even when you're networking and like not having an ask the first time that you meet somebody, like you have to figure out if
Yeah,
there's like synergy and understand if there's like a way that you can also bring something to the table because at the end of the day, that's why you're there. And like I've done huge PowerPoints on networking and like, my philosophy around it. But I think that's one of like the really, really the biggest things.
yeah, I couldn't agree more. As someone that is a little bit more popular on LinkedIn, I get so many messages a week, and they're the same cookie cutter messages of like just asking me immediately for something. And I can't help, one, I can't help every person that asks me. And two, I found that it was draining me. I just felt my life force being drained by every person that was just like, hey, you, give me your leads, or hey, you, I want this piece of you. Um, but every once in a while, someone would come in and just be like, hi, how are you? How's your day? Or just like not ask for something, or like very occasionally pay me a compliment. And I'd be like, I want to get to know this person better.
Yeah,
So, in the sea of people that are just trying to like take, it really helps to just like, even if you do want something, to like
yeah,
put a pause on it, get to know the person, see if you can offer anything in exchange
100%.
first. It's such a big difference. I always remember those people over the other people.
It's a lot. It's a lot, and you got a lot being thrown at you, And I know that we've chatted offline a lot about these
Yeah,
sorts of things, and you really have to be good to people. I think that at the end of the day, we should all be out there, just to try and help each other in whatever way possible. Whenever I have a new connection, it's like, let me know if I can leverage my network to help you, and I mean it. And sometimes people
yes.
take me up on it, and I love that. For me, like if I could have a full-time job just connecting people and like being a networker, I would 100% do it. But I'm like, is that recruiting? I'm like, I don't think I want to be a recruiter. Like it doesn't quite make sense. So,
You'd be so good at that. No,
oh
I
my
do the
God.
same thing though. Everyone that I've had on the podcast, I end the same way. Like, if I can help you, even if we don't talk for a year and like you need like a light favor, like reach out. I'm happy to do that, especially nurses. I have such a soft spot for nurses.
Totally.
Like, all I want to do is like lift up our community. And I say that to people on LinkedIn too. Like, when we connect, I'm like, if I can do anything for you, like, let me know. I can't do that much, but if you can find anything, like I'm happy to support where I can. I feel like the world is so hard for nurses sometimes. So the least I can do is like
Yeah,
a little bit of sunshine for someone. So yeah,
I
I'm all
love it.
about that too. Yeah.
I love it. I think it's that altruistic, feeling or whatever. And it's like my grandma Rosie. Anybody who's met me has heard me talk about her. Like,
Yeah.
she says if you don't ask, you literally don't know. And I think, everything starts with a yes, right? I saw a sign walking down like the street in Madrid the other day. It's like everything starts with a yes. And so that yes might be connecting with someone, like just like, and you just never know where things are going to go. And so I think it's just being bold too, and then just saying like, you know what, that person might be a CEO or they might be a VP of this or that. Like, if you're not wasting their time and you have a real like rationale for talking to them, come prepared, right?
Mhm.
But I don't think there's any reason that anybody would be like, I really don't have time to talk to you. And if they don't, you have to walk away and be fine with that. But
Yeah.
that there's a lot of strategy behind it, but I think at the end of the day, more important than strategy is really just being a good human and just like trying to help people wherever you can. So it comes
Yeah.
back.
Yeah. What helps me when I get kind of like weird about like talking to like a CEO or a vice president or someone that's like really important, like everyone is just like a human with like a favorite song and a favorite
Yeah,
color and like a family that they love. And like I'm just talking to like human to human. Like I'm talking to a very important human, but
yeah,
it's still like a human with like empathy and feelings. So, and to just treat that person with empathy, not like a robot that I'm just trying to like suck their life force out of. So, yeah,
yeah.
that's always helped me because it was like intimidating to have these big conversations like with big people. Especially my main networking tool is on LinkedIn right now. So I'm
Same.
networking with a lot of people on LinkedIn, like global companies and everything. And
Yeah.
yeah, it was really intimidating to be messaging these big people on LinkedIn. But once you start doing it, you're like, oh, I'm just talking to this guy about his weekend plans.
That's
Like,
it. That's
yeah.
it. And just remember too, like as important as they are, you've got to think there's always a hierarchy. You might be that intimidating person to somebody, right? I've talked to
Yes.
like a lot of people from like, for instance, Rutgers University. Somehow my name got out there, and like I've talked to like a bunch of students from there, and they're like, "Yes, sir," blah blah blah. I'm like, "Whoa, whoa, whoa." I'm like, "Let's back up." Like
Oh,
I'm not somebody like, that you need to like call sir. I'm like, I've never been that guy, like whatever. All I'm saying is that like, I think that people have this perception, and
yes.
you said it best. Like, I mean, we're all just people. And guess what? You sit down, everybody's got a story to tell. And it's something that I've always thought about, even as a little kid. I used to think like everybody has a story, right? And so like
Gosh.
I don't know. I just love sitting down and getting a piece of, everybody's story when I'm like networking. I think it's like for me the best thing.
You were like a born networker, Manny. Like I can just imagine you being like a little kid on a playground, like networking
Yeah,
with other kids. Like,
yeah,
oh my gosh.
yeah. Here's the thing. Yeah, I've kind of always been a nerd. It's cool. Like I don't know. Yeah,
No, that's awesome. That's like a beautiful thing. I can definitely
yeah,
see that part of you that shines. Like in every interaction, you're very on key with feeling the vibe of the conversations because we've had a lot of conversations over the year now,
yeah.
and you're very good about reading people. So I could definitely see how that translates into the business side of you, and definitely your pharma representative experience and your sales experience, and also your patient care. I bet you are
Yeah.
top notch with patient experience as well.
I'll tell you one story, and this is not a
Please.
lie. So
Yeah.
I was working as a charge nurse on a bariatric floor, and that's where I was actually borrowed from One South at the Vidant Medical Center where I started out as a nurse. And so I was working on 3 North, and I'd have these patients, they'd come in bariatric surgery. Like, it's one of the few places in the hospital that people come because they want to be there. Like, I want to get bariatric
Yeah.
surgery, lose weight, and like feel better, be there for my grandkids, this whole thing, right?
Yep.
Well, I loved it, and I was like in my element, and I knew exactly like what the whole treatment plan was going to be with these patients when things were going wrong, their telemetry. Anyway, so I got to know a lot of them really well, and I would discharge them. And, every time I'd be like, hey, you're going to get a survey. I'm like, you're going to get a survey. So please be honest. I want to know if there's something that I can do better to be a better nurse.
Yeah.
And little did I know that all of those patients were going through and passing in compliments. So the compliment department, the patient experience department actually came up, and they were like, we've never had another nurse get this many compliments. They were like, "What are you doing?" I was like, "I'm very sarcastic, like with all of them." I was like, I'm super sarcastic with everybody. Like, no, really. And like I told them, I was like, one thing that's followed me, and it's kind of again like a common denominator, you have to ask for the business. And I think if people take nothing away from what we talk about today, you have to
Yeah.
ask for the business. And if that's if I say, hey, great podcast, awesome, how about you put it in an email so that I can use it later, right? Like, or if I say, hey, like, please fill out that survey, great, instead of saying like, oh wow, you did a really great job, well, please put it on paper so that it can help me in the future.
Yeah,
So
totally.
to all the nurses out there, you're doing a great job, but just make sure that you're documenting it as well. I can't believe I just said that out loud. Make sure you're documenting it. Make sure that you get it documented so that that you can build a portfolio. But anyway, I love that story because I think nursing for me was the most fulfilling job that I've had, and it's something that I feel like is always going to be at the heart of what I do, no matter what I do, where I go. I know that it's always going to lead back to that because it's something that's like really, really ingrained in me. And I think it's work that matters.
Yeah, I was just gonna say once a nurse, always a nurse, Manny. Like
Totally.
that's your core no matter what. All right,
100%.
so we unfortunately have to wrap up, Manny. I could literally just talk to you all day long. I'm sure that's the
You,
networker in you.
yeah, you could call me. Well,
Thank
thank you for the
you.
opportunity.
Yeah, thank you so much for coming on today. I know that so many of our listeners learned a lot about pharmaceutical representatives that they had no idea before. So this was incredibly informative. Thank you so much again.
Awesome. Thanks for the opportunity. I'm sure we'll talk soon.
Yes, we will.